6 Henson Tower is a 25-bed medical surgical unit with several specialties alongside general pediatric patients. We care for pulmonology patients, including children with asthma and cystic fibrosis. We see endocrinology patients, whether they are diagnostic testing or managing diabetes. 6 Henson also specializes in caring for neurology patients experiencing seizures, especially those needing prolonged monitoring. We help patients who need medical stabilization because of eating disorders. And finally, we care for tracheostomy patients. As you can imagine, our nurses develop a very broad knowledge base by working with so many different diagnoses. We work the standard 12-hour shifts, and nurses generally have a patient load of 3 to 4 patients. In addition to our department director, we have both day and night shift assistant directors. It makes a big difference to have that leadership visibility and availability 24 hours a day. On 6 Henson, you'll get to learn some unique equipment and care techniques. We have an epilepsy monitoring unit that contains 4 EMU beds set up for neurology patients to receive EEG monitoring for 24 to 96 hours. We are also one of only a few units that use ketone meters to detect diabetes ketoacidosis. On a shift, you might be doing anything from titrating an insulin drip to helping a family learn how to manage a new tracheostomy. Every day is different. As pediatrics has shifted toward a busier pace and the acuity of our patients has risen, newer nurses may discover it can be challenging to find the right amount of time to devote to being at the bedside. While it takes a lot of work during orientation, we always support our new nurses as they learn the balance of time management while caring for an ill child. Our orientation for new nurses is generally 10 weeks long, half on day shift and half on night shift. Our new hires work closely with a preceptor and educator to fine-tune their training. We make sure you get the experiences you need to learn and feel confident. We tell everyone, there's always somebody here, whether it's your charge nurse or your leader. Ask questions. There are no wrong questions. We make a point to support you both during orientation and afterward. We strive to foster a culture of teamwork and support on 6 Henson. It's a cohesive environment. Float staff and applicants who have done rotations here tell us that they feel supported by our team. It's great to know you're working alongside people who are like-minded. We all have the same goal: provide an excellent hospital experience for our patients and families. Staff value the bonds created with our cystic fibrosis population, who we see with some regularity, and with families who are here a little longer for tracheostomy teaching. But even when patients are in the hospital for just a day or two, it's satisfying to see them get better and go home. Working on 6 Henson is truly a rewarding job.